Hi everybody, my name is Dinah and today we're going to talk about antiplatelet therapy. Antiplatelets, good examples are aspirin and Plavix, play an important role in the prophylactic treatment of myocardial infarction and ischemic stroke. Antiplatelet therapy is often prescribed to patients who have a high risk of having an ischemic stroke and or a myocardial infarction in the future. So why choose an antiplatelet? What are platelets? Platelets play a key role in the formation of a thrombus, which is the main cause for ischemic strokes and MI. Thrombus are made mainly of platelets, are found in the arteries, whereas venous thrombus are mostly made of fibrin. Platelets monitor the endothelium, and when it becomes injured, the platelet will adhere to the injured area. This causes a chemical reaction, which causes more platelets to be activated. Once those platelets are activated, then they begin to aggregate around the area. The platelet aggregation then causes the artery to be blocked or occluded, which deprives the area of oxygen, causing ischemia and eventual infarcts. So the two major antiplatelets that we talked about already, aspirin and Plavix, we're going to compare the two medications. Both are antiplatelets, like we said, but both work in different ways to inhibit platelet aggregation. Aspirin does have more drug interactions to take into account when prescribing other meds, whereas Plavix only has the one, omeprazole, which can reduce the antiplatelet effect, which is not what we want. Both medications are recommended by the American Heart Association, with multiple studies showing the effectiveness in reducing the chance of an ischemic stroke and an MI. The American Heart Association actually recommends Plavix in addition to aspirin rather than just one or the other. While both medications have an increased risk of bleeding, aspirin does have more side effects than Plavix. Some of the side effects are angioedema, bronchospasm, GI disturbances. When it comes to cost, aspirin is still very cheap. It's an over-the-counter medication. There's many options available, so you can keep the cost down, such as going for a generic brand and depending on the dosage. On average, it's about $5 for 300 pills. Even though it is an over-the-counter medication, you still need a doctor to guide the patient on how much of the medication, what the dosage should be. Plavix does require a prescription, but it's still relatively inexpensive considering it is a prescription. On average, it's about $10 for 30 pills. So what we're trying to do here with the antiplatelets is, like we said, reduce the risk for MI and ischemic stroke in the patients. In most instances, both of the medications are prescribed. It's called dual therapy rather than just aspirin alone to increase the effectiveness of the prevention.